Hi, everyone. Thanks so much for joining me on this week's episode of The Skin Reel. I am really excited to have my colleague, Dr. Jacqueline Watchmaker, on with me today. She is a laser expert and is going to be sharing with us lots of great tips and pearls about laser and energy-based devices. Dr. Watchmaker practices medical, procedural, and cosmetic dermatology at Southwest Skin Specialist and the Center for Aesthetic and Laser Medicine in Scottsdale, Arizona. However, she did her dermatology training at Boston University and then did a prestigious fellowship at Skincare Physicians in Chestnut Hill with Dr. Jeffrey Dover, who actually was on the podcast a few weeks ago. And she is an expert in energy-based devices and lasers, and she enjoys lecturing on these topics nationally and internationally, as well as writing multiple book chapters and lots of research papers. But she says that still, with all of her accomplishments, the most rewarding part of her job is instilling confidence in her patients through the treatment of their skin conditions. And I couldn't agree more. That is one of the most rewarding parts of what we do, isn't it? Thanks so much for being here, Dr. Watchmaker.
Thank you so much for having me. I'm excited to be here.
Let's just start off with basics. What are lasers?
So, lasers, it actually is an acronym. And laser stands for light amplification by stimulated emission of radiation, which is kind of like a mouthful. It's a lot of
Yeah.
words. Um,
Now we know why it's shortened to laser.
Exactly. But to kind of simplify things, all the kind of the definition of a laser is that it has monochromatic light. So it has one kind of wavelength that it emits. And depending on the wavelength, it kind of tells us what the laser is best at treating. So there are wavelengths of light that are kind of best absorbed by, red blood cells. And so those lasers treat things that are red. There are wavelengths of light that are best absorbed by water, which is a big component of collagen. And those lasers are best at kind of, regenerating collagen. A laser is, it can be a lot of different things, but it's always monochromatic light. And in dermatology, we use them to treat a wide variety of skin conditions.
Yeah, that's so cool how it's really super specific for that pigment and that color, that wavelength. That is really really neat, and the physics behind it is really cool. Now, I know we use that term laser, quote, kind of loosely because there are a lot of things that people call lasers that aren't really true lasers. Is
Right.
that right?
That's definitely correct. I think the most common thing that people call a laser that isn't a laser is like an intense pulse light device or an IPL device. Sometimes people call them photofacials or BBL, broadband light. And you can tell by the name broadband light, it has multiple wavelengths of light that are emitted. So by definition, IPL and BBL devices are not really lasers. But sometimes people even call radio frequency devices and microneedling devices and ultrasound devices lasers, which isn't correct, but that's okay. Not everyone's a laser expert.
That's right. Yeah, it's not technically right, but we know what people mean. But yes, lasers really have to have that chromatic wavelength, don't they?
Yes, yes.
So, how do we use lasers in the skin? Are they just all for making people younger and beautiful and cosmetic indications, or what are sort of the uses for lasers in dermatology?
Great question. Actually, one of my favorite, uses of lasers is to use it for true, medical conditions. Treating scars of any kind, acne scarring, surgical scars, traumatic scars, treating, birthmarks like port wine stains, and things like nevus of Oda. We can use lasers for even things like warts and things like pyogenic granulomas. We can use lasers for. So yes, we do use them. I would say primarily for kind of skin rejuvenation and photo aging, and kind of on the cosmetic side of things. But actually, my practice is a lot of using it for medical conditions, which I love. I mean, all of it is very rewarding, but yeah, it can be used for so many different things.
Yeah, it's so much more than just removing someone's unwanted leg hair. There's so many amazing applications for lasers. It's really so cool to see and can be really life-changing if someone has a huge pigmented lesion on their face and they're a child or a large birthmark. Laser experts like yourself can really can change a person's life using lasers, which is amazing.
Yes, it's very, very rewarding. Yeah, my favorite thing is treating acne scarring, and as a dermatologist, I take them through, the treating of their acne, and then we can kind of come full circle and then treat their acne scarring, and just, seeing patients on that journey, is amazing, and especially the end result is very rewarding.
Yeah, I have to ask, what is your favorite laser for treating acne scars?
I would probably say the 1550 nanometer Fraxel laser. It is very effective in all skin colors, and typically, teenagers tolerate it well. Usually, depending on the degree of acne scarring, we might have to do up to 6 or even 8 sessions, but usually we can always improve the texture of the skin by at least 50%, if not more. I do also, especially for acne scarring, like to combine it with other non-laser modalities like microneedling and something called TCA cross, where we use like a very strong chemical peel right in the base of some of the acne scars. But lasers are kind of the primary thing that we use to treat acne scarring.
You made a great point about that we can use it safely in all skin types because it's important to know that not every laser can be used in every skin type. Can you elaborate on that a little bit?
Definitely. I think that this becomes kind of most apparent with the hair removing lasers, just because they're so ubiquitous. So many, especially non physicians are doing, laser hair removal. And it is very important, especially for the pigment targeting lasers, to use, the appropriate laser in the appropriate, settings in different skin types. For example, skin types 1 through 3, which is, Caucasian patients and some light skinned Asian patients, we use what's called typically a 755 nanometer Alexandrite laser. Sometimes we use a diode laser for hair removal. But using these wavelengths of light in darker skin can be, very dangerous because those lasers pick up pigment both in the hair follicle but also in the epidermis, and it can cause burns on the skin. So we have to use a different wavelength of laser, which kind of bypasses the top, layers of pigment in the skin to just reach the hair follicle pigment. And typically we use the 1064 nanometer Nd:YAG laser for darker skin.
Yeah, the lasers are smart, but it can't always differentiate the pigment in someone's skin from the pigment in the hair follicle unless you use a longer wavelength. So that's a really great point and another excellent reason to see someone who really has laser expertise, especially if you have darker skin. I saw something on TikTok not long ago about a woman who I forget the laser that she had, and she really had significant burns, which then left these rectangular white marks all over her face. So you have to be really careful, even though these are everywhere and it seems like, oh, it's how hard is it? You just click a button, right? And it makes a zap noise. But you do have to be really careful, especially with certain lasers in certain skin types.
Definitely.
What I'm a Mohs surgeon, and so I am dealing a lot with scars. What is your favorite laser for scars in general?
I would say the CO2 laser. The CO2 laser is what we call an ablative laser. So it actually kind of vaporizes columns of skin, um, and then creates these kind of micro injuries that then allows collagen remodeling. It is one of the more aggressive lasers, but scars sometimes, we need to be aggressive with them because they can be thick and sometimes even impair mobility depending on where they are on the body. um, so usually I use what's called like low density, high energy CO2, and we get great, improvement in scar texture. I also, especially for scars, like to do something called laser assisted drug delivery, where after I create those little micro columns in the skin, I topically apply Kenalog or a topical steroid, and it actually goes down into those little channels in the skin and can also contribute to kind of softening of the scar. Um,
What do you put on topically on the skin?
Typically, I do 4D Kenalog. Occasionally, I'll mix it with a little bit of 5-fluorouracil as well, but typically 4D of Kenalog. And we can also do for like atrophic scars, so scars that are more depressed. Sometimes I apply poly-L-lactic acid or Sculptra, and studies have shown those little Sculptra particles get into those little channels and can kind of help regenerate collagen even more than just, doing the laser alone.
It's so cool to hear how a laser that makes those little micro channels in the skin is now being used to deliver drugs. And people are definitely looking into this for all the possible benefits out there. But I will do it with like microneedling and sometimes with chemical peels and things like that, just to get that deeper penetration, which you can get with those little micro channels.
Definitely. It's a great little trick and super easy to do. Anyone can do it.
Well, anyone with laser expertise, right?
That's true. Any qualified position, yeah.
That's right. Yeah, and it doesn't require any more injections or poking and all that, which is nice too.
Yeah, no, definitely. It really just depends on the type of scar. Some scars are kind of pretty flat, but just pink. So then I do love using, the pulse dye laser is what I have. Typically, it requires, at least 3 treatments, but it can really draw the pinkness out of scars. If again, there's, texture or some, a contracted scar, that's where I go to the CO2 laser. If it's just, a mildly elevated, not so bad scar, sometimes I'll just do the Fraxel 1550. But yeah, it really depends on what the scar looks like. Sometimes if it's a hypopigmented scar, so lighter in color, I'll laser and then apply topical bimatoprost, which has been shown to kind of repigment hypopigmented scars. So you kind of have to, yeah, I look at the scar, figure out what's wrong, and then kind of, laser accordingly.
Yes, yeah. A scar there, when you say scar, it can mean so many different things, right? It's not just a one size fits all. There's very different kinds of scars. There are acute scars, more chronic scars, scars over, joints and parts of the body that require movement. So there really depends on what type of scar, and a real laser expert will be able to assess that and then pick the laser that's best for that scar. Earlier, you had mentioned, or several times actually, that these laser devices require a series of treatments. Can you kind of elaborate on that? It's not just a one time in and out kind of deal.
Usually not. Occasionally, some of our, pigmented lasers patients are happy after one treatment, or if, usually for, especially treating, some, lots of, pinkness in the skin or a very, thick scar or just a lot of sun damage. I always counsel patients it takes a series of treatments. Anything with the skin takes time to both heal and kind of remodel. And usually, depending on the laser and the treatment, but usually, at least 3 treatments spaced a month apart. But again, it's very variable depending on the patient and what condition you're treating.
Yes, exactly. But yeah, don't be surprised if your laser expert does recommend a series of treatments. It's in fact actually really common, and a lot of times it's for your own benefit. I know we all want things quick and a quick fix and done and perfect, but a lot of times doing a series of treatments is really the way to go.
Yes, especially with darker skinned patients when sometimes we have to start with, lower energy so that we're being safe in their skin, it does sometimes require definitely more as well.
Yes. Now, with the weather getting warmer and summer out, are there certain lasers that are a no-no in the summertime?
That's a great question. I get that question a lot, and I really think it is person dependent and almost location dependent. When I used to live in Boston, we used to, avoid doing a lot of the lasers, especially more the pigment lasers in the summertime, because you really have to be good about sunscreen after the resurfacing lasers and some of the pigment lasers. However, in Arizona, in the summertime, it's very hot, so most people are kind of more indoors. So usually I tell my patients if you're going to be good about sun protection, we can laser you any time of the year. But I always say, pretty much no matter what laser we're doing, I don't want you to have a tan. So I'm like, if you go to Hawaii and come in with a golden bronze tan, we're going to have to reschedule. So, protecting yourself from the sun both before and usually for a few weeks after is very important. But it does slightly depend on, the procedure we do, the type of laser, the intensity of the laser.
You made a good point because I too trained in Boston, and now I live in a warmer, a sunnier, I'll say, climate. We still have the four seasons usually, but in Arizona, I can imagine it's really, is there really a huge difference in sun from January to August? But certainly it's hot in the summer. So you make a good point. If you're just inside, then it wouldn't necessarily be a no to not get that procedure done.
Right. But even inside, you have to wear sunscreen because, as we know, UV rays can come in through car windows and,
Yeah.
house windows. So,
Yeah, people get more sun than they think. And I always tell people too, you're spending money and time on these treatments. So protect your investment and make sure you're protecting your skin and wearing sunscreen. Because if you just spent a lot of money on a resurfacing procedure, you don't want to go screw it up on your cruise in 2 months. So, sun protection for sure, all the time. Now, we've sort of talked about medical applications of lasers. What are some of the cosmetic or some of your favorite cosmetic procedures that you can treat with lasers?
probably my favorite one, especially being in Arizona, is the 1927 thulium laser. And there's a lot of different, device companies out there that make a 1927 thulium laser, and they're all a little bit different. Fraxel makes one. There's one called the Laze MD. There's a new one called the Moxie. There's the Clear and Brilliant that all use that 1927 wavelength. And that wavelength actually stays very superficial in the skin, but that's good because it can help with those superficial fine lines, and it can also help with that superficial pigmentation and some of those, lentigines and sun damage. It can also help treat, little precancer spots, actinic keratoses. I love, the thulium laser because it's predictable. Patients see results. There's not a ton of downtime. I actually just had one this morning. Depending on the, settings you use, you're, pink and puffy for a few days, but, I usually laser on Friday, definitely back to work on Monday. They don't really have to take much time off of work, if any. And yeah, patients see results. And actually, a new study just came out of Harvard that showed using these non ablative fractional lasers like the thulium and the 1550, you can actually help prevent some skin cancer formation. So I always tell my patients, especially in Arizona, everyone has sun damage. And, 90% of people by the time they're 70, have a basal cell. So, we can do these lasers for both the cosmetic benefit, but also the medical, cosmetic and the medical benefit. And usually, that sells them on it if they're not already.
That's right. They feel good. It's not just for cosmetic indications, right?
Right.
But that was a cool study to we've always I know even when I was in training 10 years ago, we've always sort of thought this likely could help prevent skin cancer, right? By removing those malignant cells and stimulating collagen and everything. And it's nice to see it finally published out there in the literature. So that's really exciting and cool. I don't predict insurance is going to start covering this laser procedure, however.
I know. I don't think anytime soon. That is one of the frustrating things, even for, when we're treating acne scarring, which is arguably a medical issue, or even kind of, rosacea, we treat with the vascular lasers. Insurance, companies view it as cosmetic, so they don't cover it. And I unfortunately don't see that changing anytime soon.
Yeah, it is too bad because it is quite effective, and it's too bad that it won't be covered like medications and things like that. I'd love to hear your thoughts on the lasers for acne.
Yes. So they're new. They specifically target the sebaceous glands, the oil glands that, create acne. Typically, it's a series of 3 treatments spaced around a month apart. And we have about, year-long data that shows a good proportion of patients who complete the 3 treatments, have good improvement in their acne. Um, We don't currently have one yet where I'm working on getting one. I do think it's a great alternative for patients who don't wanna do, oral medications, especially Accutane. Um, and so far, the data seems to show that, the results from these lasers are kind of similar to the results of Accutane in that, the sebaceous glands don't, kind of come back after. So I think it's going to be a relatively, permanent almost cure for acne, which would be great. I've had the procedure done. It's a little pinchy, but it's really, especially one of the devices, the Avoclear. You don't really do any numbing medicine, and it doesn't take long at all. It's a relatively easy procedure to do, really not any downtime. So, yeah, I look forward to seeing more long term data and seeing more studies, but I'm very optimistic about them.
Yeah, that would be great to have a treatment that is not systemic and that can really provide dramatic results for people with acne, and hopefully by treating their acne proactively, we are also helping prevent scarring. Well, we know we are, right? That's a great alternative. Although we do have some, isotretinoin is a very effective treatment for acne. It's not a good fit for everyone, and it does have side effects. So being able to treat acne with a laser is really, really cool. Now, this may not be a laser. What about the microcoring? Is that a laser?
It's not a laser. It actually uses these little, they're almost like hollow needles that takes out tiny, tiny micro cores of skin, like thousands of them in a treatment. And the little tiny cores of skin that are removed with the treatment are beneath the threshold that causes a scar. So similar to how when you get an IV, those needles are quite big, but you never, get scars after you get an IV. So it's kind of a similar concept to that. And your skin kind of just contracts after after the microcoring procedure. What's remarkable is typically after microcoring, by day 3, you're just kind of a light pink. Immediately after, it looks a little gory. You have all these, like, tiny, tiny holes in your skin, and you do have to do some good, usually injectable anesthesia, but the recovery process is quick. And I think it's, a great, it's another tool in our toolbox and kind of a novel idea that we haven't been doing before. And I think for scarring, for stretch marks, for, drug delivery into the skin, I think there's, a ton of applications that are just now being explored with the microcoring device. So I look forward to, hearing more about it in the coming years.
Yeah. Now, and again, I'm sort of delving into more energy based light therapy. What about cellulite? It seems like everyone's got it, everyone hates it, and there's no good treatment for it. So, are you familiar with any of the energy based devices for that?
Yes, there's, a few. Um, Cellulite's tricky. People a lot of times refer to cellulite as just kind of the rippling of the skin, especially of kind of the anterior and posterior thighs. And technically, this is more skin laxity than true cellulite. So typically for that, injectable biostimulators like Sculptra is what I prefer. Sometimes radiofrequency devices like Thermage can be used. I'm not super impressed with how those work, but for true cellulite dimples, which are caused by little kind of septa under the skin that are kind of tethering and pulling the skin down to create those dimples, there's a few options. One of them is called Resonic. And it basically uses high frequency sound waves to kind of break up those septa. I know they're kind of the company that acquired it is kind of redoing the device because it used to be very loud. It's like this basically intense vibration kind of over your cellulite to break up the septa. And they're kind of working on optimizing the treatment. There is another treatment called Avali, which actually uses mechanical subcision. So it's this little device that's inserted under the skin that kind of latches onto the septa, and then you're able to individually cut the septa that are specifically causing the visible cellulite dimples. So it's actually, yeah, mechanical subcision. And I do this treatment. It definitely works very well. But again, it only addresses those dimples, not so much that skin laxity that I think a lot of women are concerned about. I know Quo was just taken off the US market. I think it just caused way too much bruising for it to be successful. Um, But other than that, there's not, a ton of good things out there. I know all over Instagram, people say like these body scrubs, and,
Yeah.
you know,
Caffeine and
caffeine, but, none of that is really, addressing cellulite. Cellulite is hard, but I think industry realizes that, it's a unmet need, and I think, that's where a lot of these newer devices and companies are filling a need, and I think there's, still work to be done, but, some new exciting things that are currently being done.
yeah. And tell me, what are you most excited about in the world of laser or energy-based devices coming out in the next couple of years?
Ooh, what am I most excited for? I think, there's just so much that we haven't explored yet. I think especially if microcoring turns out to work well for off face, that skin laxity on the arms that we really don't have any other good treatment options for, that's going to be huge. Or kind of like the skin laxity above the anterior knee. I get that question, 5
Mhm.
times a week, how can we treat that? And I basically just tell patients nothing. Surgery is not a good option. None of our minimally or non-invasive, options are good. But I think if microcoring can be optimized and can treat that, that's going to be, very, very exciting.
Yeah, definitely. As, as someone who's now in her 40s, I'm like, wait a minute, where is this skin coming from? Can you give us sort of your top three pearls for our listeners who are maybe thinking about getting a laser or energy based device? What are sort of some top tips they should be thinking about before they have the treatment?
Yeah. Um, I would say one, definitely, see someone who knows what they're doing. That lasers are a large part of their practice. Um, I did an entire year of, basically just laser training. So, I feel confident, treating patients of, again, all skin types and colors and, all sorts of conditions. And, not everyone is that comfortable. I think for, relatively simple procedures, there are, other people who, might be sufficient, but especially if you have a complex condition or darker skin, you definitely need to see someone who knows what they're doing. I think that's pearl one. Um, Pearl two would be you got to protect yourself from the sun leading up to the day of treatment and then after. Sunscreen, wide brimmed hats. And then three, don't expect overnight results. You know, Everything takes time with the body and, be patient. But especially if you, go to someone good and they have good devices and know what they're doing, you will see results, but it can definitely take some time.
Yeah, that's a great point we didn't touch on earlier. Just to have kind of realistic expectations and discuss this with your doctor before having the treatment so that you aren't disappointed, that you're aware of what this laser device can realistically do and what it can. They're amazing lasers and they can do amazing things, but they do have limitations, right? So you want to make sure that your expectations are aligned with what it can provide, because you're most likely spending a good bit of money and you don't want to be disappointed.
Exactly.
Yeah, those are all really great pearls. And it's been a lot of fun talking with you, Dr. Watchmaker. Where can our listeners find you if they want to follow you or get more information?
Definitely. I would say you can follow me on Instagram. My Instagram handle is just my name, Jacqueline, Jacqueline, watchmaker, just how it sounds, MD. And I post a lot of fun procedures I do, things I do on myself, and, fun pearls from conferences and things on there. So, yeah.
Yeah, I love that on Fridays, that's when you do your cosmetic procedures, because that's what we all did, especially we called it Fight Club on Fridays, and that's when you try out things, play around, and have fun. So, all right, well, I will put your social media handle in the show notes so people can reach out to you if they'd like. And I really appreciate you taking the time to talk with us.
Thank you so much.
All right, take care. We'll see everyone next week.